Good evening. How do we slow this new spread, Dr. Gottlieb?
Well, look, we need to find the source of the spread. We're not going to shut down the country again. There's no appetite for that among the people or the political class. And so what we need to do, and we shouldn't have to because we have better testing in place, better case-based interventions, the ability to target where the infection's spreading. We have the tools to do that now. We just need to find where it's spreading. So if you look at Texas, for example, 24% of the hospitalizations in Texas now are people between the ages of 20 and 29. In a lot of counties, a majority of the infections are people under the age of 30. And so the governor has suggested that he thinks a lot of the spread is happening in bars. They reopened their bars to 75% capacity. They can rethink that. They can start limiting capacity in bars. And for bars that are non-compliant with the measures, the distancing measures that they have put in place, and a lot of bars are non-compliant with those measures, they can shut them down. And so the state's going to need to take targeted actions. There's probably not a need to do a sort of a statewide shutdown or a rollback of all the reopening measures, but you need to target those interventions on the places where you know the spread's occurring. And first, you need to find it. A lot of states haven't really found where their spread's occurring, and they have a narrow window now to do that.
Is it because we're just not contact tracing enough or not accurately?
That's right. We're testing a lot, and so we're identifying the cases, but some states aren't doing good contact tracing work. So I wouldn't be surprised, for example, to see Arizona take over that contact tracing work from the counties where it currently resides and do it at a state level. The CDC has sent in some experts into these states now to help assist with that work, but some of the states haven't invested in it and stood up these capabilities, and so they're a little bit behind on that. And so, again, we have a week or two. They can get control of this. But if they don't do it and we continue to see these cases build, this could get out of hand. So we need to intervene with those kinds of targeted measures.
So obviously hospitalization numbers are rising. That comes before we really start to see the mortality rates. Dr. Gottlieb, when do we expect to see that at this point? And what are your expectations there now that we have had some time for hospitals and medical professionals to learn more about this disease and how to fight it?
So typically the time from hospitalization to death is about 10 days to 14 days. And so you're going to see a spike in deaths probably 2 weeks out from when you're seeing these hospitalizations start to rise. That said, more of the hospitalizations are in younger people now, and so the death rate should come down because the demographic has changed. Older people are doing a better job of protecting themselves, and we're learning how to treat this a lot more effectively. Anticoagulation using blood thinners was a big advance in care. Being more conservative about intubating people because putting people on a respirator was damaging their lungs. The use now of steroids, which was validated in the study yesterday. All of these things, and the availability of the antiviral drug remdesivir, which acts directly on the virus, all of these things are going to improve care and help improve outcomes. So we should see death rates come down as a percent of people who get hospitalized.
What would your advice be tonight, Dr. Gottlieb, if you live in one of the areas, one of the states where there is a hot spot, if you're over the age of 65 or younger and have a chronic condition like diabetes or hypertension, what should you be doing right now?
Limit your activity and protect yourself when you go out. I mean, try to limit the number of times you go out, the number of times you go shopping. Don't go into crowded places. Avoid restaurants, bars, settings like that. Congregate indoor settings. And when you do go out, wear a mask. And part of the challenge of these states is that they've been a little bit complacent, quite frankly. You look at the pictures, you talk to people in these states, people don't wear masks. It's the exception that someone does wear a mask versus in a state like where I am, Connecticut tonight. I was out today, everyone was wearing a mask. And so the etiquette is very different because states that were very hard hit, our behaviors have been conditioned differently than states that weren't hard hit at the outset and now are having really their true first wave. And so people are more complacent. That's going to be hard to recondition the behavior of people in those environments to suddenly go in and say, no, you need to start doing things that you weren't doing all along.